I'd like to welcome you to the House, Minister Abbott, and to thank you very much for giving us such a clear overview of the position as regards Disability Day services, and also to thank you for your appearance before us at the Disability Matters Committee last week as well. It's very welcome to have these opportunities to debate with you the provision of services. And I want to begin by acknowledging the importance of your statement that disability services, the provision of disability services, is regarded as an essential public service. That's hugely welcome. I think we've acknowledged that before, and that's very important. And also to acknowledge the immense work, as you have acknowledged, the immense work of both the HSE and service providers to ensure continued delivery of safe services to persons with disabilities. But notwithstanding that, of course, as you've also acknowledged, there is still immense frustration among persons with disabilities and their families because services have simply not resumed to pre-COVID levels, and I know you're well aware of that and indeed have pointed that out yourself. And indeed, even before COVID-19 hit, day services were in the news for the wrong reasons, with service providers pleading for increased resources even at that point, with service users critical in particular of the introduction of prohibitive transport fees for people travelling to day services facilities, and people left without sufficient provision on a temporary basis because of funding shortfalls or capacity challenges. So all of that was the case, as you well know, prior to COVID-19, but clearly COVID-19 represented an inordinate and unprecedented threat to the continuation of Disability Day services. And I have welcomed initiatives taken by the government and by you since taking up office. For example, the funding announcement of €10 million specifically for day services. That was very welcome. Nonetheless, the frustration continues and the level of provision still remains, unfortunately, far too low to meet the real needs of persons with disabilities and their families. And Minister, I've been in regular contact with your office about a particular case in my area concerning a boy who really does need to be in full-time school and needs the support to do that, and that I know is a somewhat separate issue, and I'll continue to make representations on his behalf to you. But I do also want to raise with you today a particular case that again will be known to you. That is the case of Philip Kelly. And he and his family have given permission for their names to be used, and indeed they've been campaigning for some time now for the resumption of day services. Philip has Down syndrome and in normal times attends day services for 7 hours, 5 days a week. Like many others, he and his family went without day services and respite care during the strictest lockdown. Even now his service has only been partially restored, and neither he nor the staff who work with him know when he will be able to build up his hours again. They're all extremely careful, obviously, in terms of provision of a safe service, yet the service just isn't fully available. So that's just one example in my own area in Dublin of the sort of frustrations that are experienced, and I know immense frustration by families and by staff as well as to when they can resume services in the normal way. And clearly there's a need to help facilities with adaptations to facilitate social distancing, to ensure safe hygiene. Facilities sometimes kept service users outdoors during summer and autumn, and clearly that becomes more of a challenge going into the winter, and many families feel it's a continual battle to try and achieve the necessary services, and the knock-on effect where the services can't be continued or where they are only being continued in a shortened or reduced way. The knock-on effect is very clear to anyone who's got knowledge of who knows anyone with disabilities who's been dependent on these facilities. A serious impact on mental health, on progress, and indeed my office, and I know other offices too, and other people in the chamber will have heard reports of people who have really regressed because of the lack of provision of day services. For adults, for young adults and older adults alike, this is a really serious issue. For young children with disabilities, key developmental stages are passing without important interventions such as speech and language therapy and physical therapy, so important developmental milestones will be missed. So I think it is a matter of really grave concern to all of us that we're seeing this level of regression, because as a knock-on effect of the crisis. One carer who contacted my office, because of course carers too are being impacted upon very severely, one carer said that it felt as though a lifeline had been taken away by the removal of day and respite services, and again that wouldn't be an unusual description of the impact. The transition to working from home has been burdensome generally for many people across the state, but for those with additional caring responsibilities arising from the reduction in day service hours, this is particularly hard. And the Family Carers Ireland indeed published a survey on caring through COVID, which I know you're well aware of, pointing out that 60% of the respondent carers reported that they worried about a decline in their own mental health and well-being as a result of the increased care burden during COVID. So in past contributions, Minister, just to conclude, I've invoked the mantra of build back better, and that's really what we need to see happen in the disability service sector, and particularly in the provision of daycare services. Inclusion Ireland's report from July of this year on day services pointed out certain priorities for the government. I thought I'd just end with those in terms of our exit strategy from COVID restrictions, timely reopening of day services, full restoration of services and supports in line with new directions, funding for COVID-19 adaptations, access to therapy and respite, and above all that the voice of the service user must be central. Gurmagad.